Welcome to the video demonstration of HFBS Health Service Planning. It is easy to find us on Google. Just search for HFBS Health Service Planning. You can evaluate and plan health services with this solution. Capture and map the current supply. Centralize information about the supply of health services in the Supply Capture module. The facilities quickly using a predefined form containing services clinical and non-clinical. Facilities are registered, you can browse and search them using a range of field names, including facility name, registration number, and various other attributes of the facilities. The facility records themselves are completely customizable, however they come with a pre-populated form that you can either grow or completely replace with your own set of clinical and non-clinical services. You can send a survey out to capture any information that you're missing. Once supply is captured, it's useful to compare and contrast with forward-projected demand. The demand module projects the need for health services in the future. Create a study and define a series of geographical catchments. Geographies and demographics you select are connected to a population projection. Next, we select the health service that we'd like to focus on. It is populated with a Diagnosis-Related Group Framework, or DRG, but you can bring your own also. A series of scenarios that we can add adjustments to. Population in the base scenario, but make adjustments in Scenario 2. The form to edit and adjust is shown in Scenario 2. You can also adjust services in the same way. Viewing results, select a series of services to show and apply filters before clicking See Results. Narrow your focus using filters. View the projected demand by service in a table that's editable like a pivot table. Drill down into detail and build out custom charts using selections. You now have a view of demand for health services into the future. Once you've created a picture of supply and demand for health services, it's possible to identify gaps both now and in the future. Gap data can be browsed by category, and you can select a series of services and specialties to focus on within that category. Visualize and browse the data by geography on a map. Browse through the years in the projection to see how gaps change. Quickly pinpoint trends. View supply or demand on their own. Drill down into geographies to view details of gaps and create reports. Projected health service gap data is a very versatile asset. You can use it to automate approvals using gaps. An example of this is the Certificate of Need solution, where license applications for health facilities can be automated. The applicant enters details of the facility from a simple form and a set of questions. They then select the series of clinical services that they would like to apply for. These services correlate to the gap data. Then, key planning unit information is entered in by the applicant. Finally, an automated approval can be given to the applicant. Other uses for gap data include capacity master plans, medical tourism plans, healthcare investment guides. For more information, please visit hfbsinfo.com.